Hello, thank you for joining us. I'm here with the team called ImmunoLynk. These guys are our first prize winners for the COVID-19 hackathon that we put together a few weeks ago. Thank you guys for joining us today. So I'll start with just having them go around and introduce each other. Can you guys please introduce yourself?
Hi, my name is Neve Higgins. I'm Irish and I'm currently living in Denmark, but working in Boston. I'm working for the Wyss Institute at Harvard Medical School. I'm working in business development, and my main background comes from science.
Hi, I'm Freddie. I finished my PhD at Cambridge last year. I'm now a postdoctoral researcher at Stanford studying microbiology. But outside of that, I'm really interested in sort of decentralizing and democratizing diagnostics to try and improve the healthcare system over here, which doesn't seem perfect yet.
My name's Siobhan Vidak. I just graduated from the University of Illinois College of Medicine with a dual degree in an MD MBA. I am currently a resident physician also at the University of Illinois in internal medicine. And what my focus has really been is just integrating the business, tech, and data aspects into healthcare and bringing a clinical perspective onto those aspects.
Excellent. Well, thank you so much for those introductions. I'm going to do a quick and simple 5-question interview. It's 3 of you guys, so please feel free to have whoever thinks is the best one to answer each question. If you want to give 2 answers from 2 different people, that's okay as well. So let's get started with the first question. How did you get involved with ImmunoLynk?
So originally we were 2 discrete teams that met at the MIT COVID-19 hackathon, I think 5 or 6 weeks ago now at this stage. We were complete strangers that met at the hackathon and collaborated over the weekend. So our team originally was just working on the blockchain aspect, and Freddie's team was working on AI aspect. Freddie's team won, and we were stronger together, so we moved forward as one team. And so we were just totally different strangers coming together, trying to essentially donate a weekend to help COVID, but that weekend has turned into several weeks on a new interesting collaboration.
Okay, thank you. Why did your team decide to focus on immunity for the submission of the hackathon?
Well, I think we realized pretty early on that for a small group of individuals as volunteers to try and really make an impact, it was going to have to be in a problem that was a bit more long-term so that we could, really start to ramp up and address that problem. And there were some amazing submissions on sort of ventilators and things like that. But actually, we realized that that wasn't the space where volunteers could significantly deliver. So we want to combine basically AI with diagnostics with regards to immunity and try and improve both healthcare and hopefully the economies by getting people back to work safely.
Excellent. Anything else?
Yes. Specifically also in the healthcare, working on the front lines and things like that, we see that a lot of healthcare workers, especially on the front lines, have uncertainties about returning to work, especially in terms, bringing that, if you get infected at work and you bring that home, are you going to be infecting, your children and things like that. So we really saw the immunity space as a place to empower healthcare workers. And not only that, I know specifically for my medical school, they were saying that they don't want medical students seeing COVID-related patients without having some sort of degree of safety in terms of a liability perspective. And immunity is one potential way to do that if we get all of the antibody test sort of hiccups figured out and pursue that further.
Got it. Thank you. I was personally very pleased to see that we had at least one submission focusing on immunity, and hence why one of the factors why you won. Where do you see the biggest gaps in healthcare innovation in general?
So I feel like one of the largest gaps in healthcare innovation is really effectively harnessing the massive amounts of data that hospitals have available to them within their healthcare systems. And then not only harnessing that, but sort of effectively incorporating it into decision-making. So you have, large academic medical centers like Johns Hopkins. They have this amazing capacity command center. They do real-time analysis of their throughput to try to optimize, admissions discharges. They also have, something else called the True Score, which is real-time analytics, sort of influencing clinical decision-making on whether patients are at risk for sepsis or other mortality rates. So you have these large academic medical centers capable of doing this because they have dedicated data teams. But you have other smaller medical centers throughout the country, throughout the world, that really don't have this capacity to do so. So I really think that, AI and machine learning have a large role in analyzing and collecting real-time data and providing real-time insights to hospitals globally.
Right. No, and I think related to that, it feels also that there should be more data sharing for the sake of research, right? So, I mean, if a player doesn't have a lot of data, well, it's kind of not fair that they don't have access to more data. I think like being able to collaborate on bigger data problems across the globe is kind of important.
Yeah, absolutely. And part of that issue is the interoperability of EHR data. That's one of the reasons why we were focusing on the blockchain specifically, because it's sort of a distributed way that you can collaborate across a large network, not just within one healthcare system. And it's a secure, distributed way to do that.
Right.
I agree. I was just going to say, I think there's going to have to be this increase in trust, because a lot more of the diagnostics, which is obviously the beginning point of healthcare, will probably move to the home, through voice assistants, basically listening out, even perhaps for things like coughs or differences in your voice, and then asking questions perhaps in a non-intrusive, just sort of interested way as well. But we're going to have to probably get used to that before that's a thing. But the combination of AI and decentralized data collection could be a huge boon for healthcare.
Yeah, absolutely. I remember a blog post by a professor from Berkeley named Michael I. Jordan. He's a computer scientist at AntLab. He was alluding to something like, there ought to be something like a global database that can power AI for healthcare, because if you think about it, when it comes to diagnosis, there's a lot of edge cases, right? And that makes diagnosis complicated for a human. But if you had the ability to look at the data from the entire globe, you would have more examples of those edge cases. So you would be able to do diagnosis through AI a lot more accurately. So I'll move to our next question. So I could spend a lot more time just talking about this. So moving on to the next question. What is next for ImmunoLynk? What does ultimate success look like for you guys?
I think a lot of our ultimate success and sort of next steps for us really just involve really honing down and making our prediction model as accurate as possible, and then really just getting the opportunity to integrate into some sort of pilot system. I mean, until we have that, we just have an idea. We have an idea, and it can be refined as much as you can, but until we have real life insights and real life implementation, we won't be able to see the pain points that we need to implement further on. So I think in terms of next steps would be getting that pilot out along with a functioning app. Then the next thing would be also getting more data through that pilot and other sources to sort of push and further optimize our algorithms. And then ultimately success, I mean, ideally for us would be widespread implementation, right, of our product. But ultimately, we came into here as volunteers to sort of try to make a difference. And a lot of it is just trying to figure out the problems with immunity and the effectively managing immunity data across healthcare workers. So I think that ultimate success will be just someone being able to accomplish this. And ideally it's us, but we just love to see someone do that.
I would add that we would hope also that this is something that could be used by anyone. So, if you really decentralize and democratize these kinds of diagnostics, what we're hoping to do as well is to combine a type of questionnaire which is as good or better than doctors might be doing when they're asking you questions as you come into their practice, and then combining it with a diagnostic like a lateral flow assay, which you can use for testing for antibodies to COVID-19. And we're already finding actually through our data so far that the combination of an antibody test with a questionnaire does find those false positives and false negatives that have given antibody tests such a bad rap at the moment. So we're thinking, we could be months away from saving people from false diagnoses, essentially through the combination of these metrics.
That's very interesting. It sounds like a paper in the making, potentially. So I'm going to ask you one more question. That is, what can healthcare companies learn from scrappy startups like ImmunoLynk?
Well, I guess we were born out of a hackathon, right? Two teams coming together. So maybe what people could learn from us is that kind of agile mindset, sprints, hackathon style. We're just collaborating together across, borders, languages, countries, disciplines, just coming together for one common cause. I think for sure is one would be a key thing moving forward for that everyone is going in the world move to, right, with Zoom and new platforms like this. Digital collaboration in particular has been a key thing for us. I mean, we're, you know, a band across the world, right? So that's also going to be a key thing moving forward. And ultimately it's mission driven. I think one thing that's been core for our teams is that we're all kind of have the eye on the prize, that we want to make a difference, that we came for that original MIT hackathon where there was actually no prize given. So it was just donate the weekend to try and help the fight in some way. And I think that's been core to us, is that having people working together towards that same mission, even though we have different backgrounds, different ideas, different disciplines, all kind of, you know, bullseye on that one mission moving forward has really helped us.
Indeed. So let me actually add one more question. How many people are there in the ImmunoLynk team total?
I would say 10 core, but we're growing. Is that
core.
an appropriate answer, Freddie? What do we think?
I'd say there are probably another 15 who've actually contributed as well on top of that.
Amazing. And how many different countries are you guys distributed through?
We think about 11 or 12 in total. If you take just the 10 that you met today, it would probably be 7. I think that's right. Six or 7.
That's pretty amazing. That's remarkable.
So you can imagine our logistical nightmare trying to figure out what time is the best meeting time. So that's one thing we're also on our success factor in the next kind of couple of days. We need to figure out a good plan moving forward for that.
Yes, you would think that AI should be able to help for things like that, right? AI should be able to
Maybe we
help
should
with
do that on the
these
side. That can be our side project, our side hustle.
Not a terrible idea. If you guys build that, I'll use it. Well, thank you very much for joining us, doing this interview and just participating in the hackathon. It's been a pleasure having you guys participate and also meeting you guys and having a chance to talk with you, getting to know you a little bit better. And I'm sure we'll get to work many times again after this, hopefully. So thank you again and have a good afternoon.
Thank you very much, Miguel.
Thank you, Miguel.
Thanks very much.